The last 12 months have seen a lot of change in the way we live. The way we work has changed as most organizations now have rosters for staff to work from home. Online shopping and delivery services have also now become very popular. The education sector has also seen some changes as now classes are offered online at some local institutions. While this has proven to be a step in the right direction, the logistics of having such a service to all students was proving cumbersome for some, as connectivity can be a bit expensive. In this dark crack, some institutions saw an opportunity to go into partnership with some service providers to offer students affordable internet for school, a silver lining that emerged from these difficult times.
The journey of DDT College of Medicine in relation to virtual learning started before the pandemic. Fortunately so, because we had gone to benchmark in places like India, Australia, on how internet and virtual learning can be used as part of the teaching modalities of institutions. So we were looking around, we had to shop very fast around, and that is when that eventually came in contact with Lightning Fast Communications. Suddenly, we were able now to provide very broad, and they were able to have gadgets that were able to help the students in their homes. That was what had led us to go for online.
While it was obvious for some sectors to take the virtual route, one that was probably a surprise here in our country is the medical field. At the outset of the pandemic, more pharmaceutical outlets offered delivery services on medication. Additionally, some medical clinics offered online consultation services where a patient can talk to a physician about their minor symptoms and get assistance without stepping into a medical facility. While this has helped to decongest medical facilities to lower the spread of the virus, it has also shown that it is not every symptom that requires in-person attention from a medical practitioner. Since this has been the realization, what other opportunities lie within this space that can improve the quality of service delivered or introduce other unusual services in our country? We're joined here by Dr. Mahlogonolo Muani, who's the Managing Director at Galafi Medical Center, one of the facilities in the country that offers virtual medical services. Doctor, thank you so much for coming here on First Issues and affording us your time. We're talking about opportunities that exist within the medical space, given that we have been seeing virtual consultations, medicine deliveries, things that we were not seeing in Botswana. So in that regard, what do you think are the other opportunities that still exist in this market in our country?
I believe that there are a lot of opportunities in this country when it comes to advances in medical technology. As you've said, virtual consultations are something that is new that we're seeing in the country. In efforts to try and mitigate the spread of COVID-19, we try to limit that human interaction, and we realized that in doing that through things like virtual consultations, telemedicines, and other services that are there, we realized that these services are actually very efficient and effective in providing healthcare to people. Just talking to other people in first world countries who have shared with us their experiences in the healthcare systems in those first world countries, just to say, when you go see a doctor, how's the experience in a first world country, even before COVID? Botswana has a long way to go, or our country has a very long way to go, because we're still trying to play catch up to what those countries were doing even before COVID. You find that you get to a hospital and you register through a machine or a robot, which will then direct you where to go, which room to go to. Then you get there, you see a doctor. There would be human interaction, but after that you may go to a dispensary or to a laboratory, or let's say to a dispensary. You find that there are also machines there. Well, there'll be people there assisting you, but you may just punch in a code or present a QR code, then your medication will be dispensed to you. That's the experience that other people in first world countries have been having even before COVID. And you realize that in our country, we still have a long way to go to catch up onto that. But given the COVID pandemic, it has presented to us opportunities, including telemedicine, which has always been there. But now, because of limitations in movements, lockdowns, more and more people are open to taking up such services. There are other opportunities in the health space, which relating to deliveries of medications. Right now in this country, because we don't completely trust or believe in technology, your typical Motswana will not be comfortable with fully doing everything online, paying online, giving the full information online. So you find that we still have to incorporate some manual efforts or physical efforts onto this. You find that even with doing medication deliveries in other countries, medication is being delivered by drones, which are opportunities that we can also look into. There's also opportunities when it comes to your wearable devices, your smartwatches, your smartphones, your smart now rings and other devices that before a lot of people, even here in this country, are open to and are using them, but have been using them for just measuring your temperatures, your biometrics, etc. But research now is going to looking at using them to even detect early detection of diseases and even monitoring of diseases.
As a professional in this field, Doctor, what do you think has been or can be some limiting factors to these opportunities becoming tangible?
A lot of limitations, as I've already said. I can just mention a few that I think are relevant to this discussion. First being accessibility to these online services or these telehealth services or virtual services, including, in this country we have very slow internet. That's number one. It's very slow, very expensive. A lot of people are not able to access internet in this country. And then also there's a lot of anxiety or a lot of fear around these technology or online services. Your typical Motswana is not comfortable with just having all the details, card information, everything, or completing everything from start to finish online. And so I believe that there needs to be education on that, because there's fear of cybersecurity issues as well, fear of being defrauded or scammers on these online platforms. Also now coming to really the health space, there's no proper regulation when it comes to virtual or advanced technologies in health care. And I think this is a limiting factor, because when there's no real regulation, you don't know which ground you're treading on. And also, although these consultations are being performed or virtual consultations are being done in the country, medical insurances do not recognize them as consultations. So having to ask a client to pay for an online consultation when they're paying for medical aid is something that clients are not very much open to. But we are seeing more and more people taking it up despite these challenges.
What investments, monetary or otherwise, do you think that relevant stakeholders, can make to support the realization of these opportunities?
As I've already said or mentioned, the issue with the internet, I think that's one of the areas that as a country we need to really invest in. The other thing is, I think there needs to be a lot of education or investment in education, from even just incorporating it in basic education or in the curriculum, to ensure that Botswana are well knowledgeable in technology. Right now, your typical Botswana may not know how to assess a website, to assess whether it's safe, assess whether it's safe to put the card information on that website and all of that. So I think we need to invest in a lot of education, even from a very basic level, on educating people on technology. The other thing that I think should be invested in is investing as a country. I'll just keep referencing to some of the first world countries. If you think about things like WeChat, WeChat is almost like an equivalent of WhatsApp. I think most of us would know WeChat as a platform, a communication platform, but that application can do so much. It's like the government uses it for official communications. It's used for making payments, your street vendors. It's almost like a cashless society. Your street vendors have access to online transactions, and these are things that we really need in times of COVID-19, because, as I said, we try to limit as much contact as possible. They're being used for contact tracing because it's able to track movement of people around hot areas or areas that are fully have a lot of COVID cases.